Hello everyone, welcome to Easy Nurse, where the learning is made easy. So for today's daily life session, I'll be teaching from mental health nursing, where I'll be teaching about the basic concept, and then this will help you to understand the subject matter better. So without any further delay, let's begin with the topic. So the concepts which I will be covering today is definition, difference between brain and mind, characteristics of a mentally healthy and a mentally ill person, and finally I'll be concluding with causes of mental disorders. So before we begin with the definition of mental health nursing, I want to start with the basic so that you'll be able to understand the subject matter better. So mental health nursing is also known as psychiatry nursing. The word psychiatry is derived from two ancient Greek words, one being psyche. The word psyche refers to mind or soul. The other one being iatria. Wherein iatria refers to healing or care. The word psychiatry was coined to represent medical treatment of the mind or healing of the soul. This word or this term was first used by a German physician, Johann Christian Riehl, in the year of 1808. So mental health nursing is basically a specialized branch of nursing which is patient oriented, mainly focusing on promoting the well-being or mental well-being of the patient, as well as assessing and providing interventions or treatment to individuals who are suffering from mental disorders with the help of therapeutic communication or evidence-based interventions. So here I want to stress on two concepts, which is therapeutic communication and evidence-based intervention. So therapeutic communication. All of you are very much aware with the word of communication since it's a very familiar term. But what do you think about, when I say the word therapeutic communication, what do you think about it? Well, communication basically refers to exchanging of information, ideas or thoughts via verbal or non-verbal cues. In case of therapeutic communication, you're not only exchanging your information, but you're also building trust, empathy, and you're also building rapport to help the patient express their emotions and feel secure. So as a nurse, you should keep in mind that while communicating with the patient, you're supposed to be honest and you're supposed to listen actively so that the patient will open up to you and you can help the patient to understand themselves better. Moving on to evidence-based intervention. Evidence basically refers to something which has been proven or a proof. Intervention refers to treatment. So, in case of mental health nursing, the care which you are going to provide to the patient as a nurse should be scientifically proven to work. In case if a treatment modality which was used in the past for the patient didn't work out for the patient, the same thing should not be carried out in the present or in the future, because it's not going to be beneficial for the patient or it is not going to help them to get better. So this is the basic concept of mental health nursing. Next, we can move on to the definitions. There are different definitions of mental health nursing which were given by different authors and different associations. But as you can see on the slide, I have only put out two different definitions which I think were really important. The first one, the World Health Organization defines mental health as a state in which the individual realizes his or her own abilities, can cope with the normal stresses in life, and then can work productively and is able to make contributions to the society. meaning a person is said to be mentally healthy when he or she can recognize and understand their own abilities, not just their physical abilities, but the understanding of their own emotions as well as cognitions, thought process, reasoning and perception. A person with good mental health will be able to solve their problems more effectively. It can be related to work, it can be related to school or everyday issues. They can solve it without being much upset or worried about it. So, in general, a person who is mentally healthy can understand the things more clearly, can contribute better to the society and can solve their problems more effectively. Moving on to the next definition, which is an adjustment of human beings to the world and to each other with maximum effectiveness and happiness. So this definition was given by Karl Menninger in the year of 1947, who was an American psychiatrist. So according to Karl Menninger, mental health means an individual being able to adjust in the society as well as with the people living in the society. And it also involves them being able to function effectively in the society and having a state of fulfillment or contentment. At the end of the slide, I have put up 2 points, which is the father of modern psychiatry, who was Philippe Pinel, and the mother of psychiatry nursing, who was known as Hildegard Peplau. I hope the definition of psychiatry is clear. Now, so before we explore the next topic, which is a difference between the brain and mind. Some of you might think that the brain and the mind are similar and the functions of the brain and mind are similar, but it is not. The brain and mind are two distinct or two different components, but they are interconnected. The brain is a physical and tangible organ, meaning that a brain is an anatomical structure which can be seen and which can be touched. At the same time, it can be studied scientifically, hence the word tangible. And it is known as the hardware. And the brain is composed of tissues and different ganglion cells, neurons and nerve endings. These neurons and nerve endings, it helps in different functioning of your body, wherein the mind is referred to as intangible or non-physical. Intangible means it can neither be touched, it can not be seen. But the mind is composed of mental processes, which includes the consciousness, thoughts and emotions. The brain is the physical structures which helps the mind to function, and this helps in your perception, your emotions and your reasoning. Even though they are very much different from each other, the brain helps in the functioning of the mind. Thus, they need to work simultaneously in order for the body to function better. Okay, the next one is relationship between brain and mind. So I have put up 3 different components, which is interdependence, analogy and interaction. As I have told you that the brain and mind are very different from each other. They are 2 different components, they are 2 distinct components, but they are interconnected. They are related to each other. In order for the mind to function or for your mental process to function better, the brain has to function properly, because brain is the structural form or a structural organ which is helping the mind to come up with thoughts, to come up with emotions and to come up with different perception. First, we will see about interdependence. Interdependence refers to relying or rely. So interdependence basically refers to relying on someone or relying on each other, and it also refers to collaborative relationship. So the mind and the brain are related to each other, where the mind is the product of the brain's activity. In case if the mind's mental functioning is affected, it leads to physical injury. Similarly, The physical injury can lead to alteration in the mental functioning. For example, if a person is physically unwell, that can be very much overwhelming for that particular individual, which can lead to different or varied range of emotion, starting from anger, which can end with depression. So it is leading to alteration in their cognitions. At the same time, if a person's mental health is affected, or if a person is suffering from a mental disorder, which can be depression, mania, or BPAD, so this mental disorders can lead to physical infliction of injury. The next one is analogy. As I've already told you that the brain is the hardware and the mind is the software. So brain is the physical part which is helping in the processing of the mind, which leads to non-subjective physical experience of emotions. So the brain is taking in the information and that information is being processed, and then the mind comes up with different emotions. Those emotions can be anger, sadness, feeling of happiness, or contentment. Last one is interaction. Interaction refers to the connection between the mind as well as the brain. So here the brain is acting as a receiver. What the brain does is it receives all the information. After receiving all the information, the mind tries to interpret all the messages and the information, and it tries to process all those information. And this process comes up, when the process is completed, it comes up with actions or feelings. So these three components are very much important. Even though the brain and the mind are completely different or completely distinct from each other, they are very much in coordination with each other. For your body to function better, your brain and your mind has to work together simultaneously so that there will be proper functioning of different parts of your body. I hope you all have understood the relationship between mind and the relationship between brain. Moving on to the next slide, which is characteristics of a mentally healthy person. As I've already discussed this topic during the introduction as well as in the definition, I would like to revise it again. So a person who is mentally healthy, they're able to make adjustment. They're not only adjusting with the society, but they're adjusting with the other people living in the society. And they're also able to solve their day-to-day problems without stressing much about it. And then they're also able to contribute effectively into the society. So one more main important feature of a mentally healthy person is they live in a world of reality rather than fantasy. When you see a person with mental disorder, they have different types of symptoms and clinical features. One of them being hallucination and delusion. These two are the very most common feature which can be seen in a person who is suffering from mental disorder. So when a person with mental disorders has hallucination or delusion, they consider it as their reality. They're not able to differentiate what is real and what is not real. They start believing whatever they're hallucinating it as real, and they try living in that fantasy. But when you come to a mentally sane or a mentally healthy person, they're able to differentiate between what is real and what is a fantasy. At the same time, a person who is mentally healthy can understand other people better. They are not only able to understand, but they are also able to help other people at the same time. I'd like to explain this topic once again, since it's important. Characteristic of a mentally healthy person. A person who is mentally healthy is able to make adjustment to the society as well as with other people living in the society. They're able to show wide range of emotions. They're able to function better. They're able to contribute or provide productively to the society, and they live in a world of reality rather than fantasy. They also show or have understanding for other people. They're not only able to help themselves, but they're also able to help other people who are in distress. So these are the characteristics of a mentally healthy person. Moving on to the next slide. Characteristic of mental illness. So I've already told you priorly that in case if a person is suffering from mental disorder, that can lead to infliction of physical injury. It can be minimal. From minimum it can lead to maximum. Like it can be very much simple, but if the mental disorder is starting to affect their thoughts, their cognitions and perception, it can lead to complex disorders of their physical functioning. So I have put up 4 different physical impairment. One is sleep and diet shift, second one is energy loss, third one is unexplained pain, and the fourth one is performance issue. Then next one, common behavioral and emotion characteristic. So here the common behavioral and emotional characteristic of a mentally ill person is mood fluctuations, social withdrawal, cognitive issues, detachment from reality, self-care decline, and increased irritability. So these are different changes in emotions and behavior which can be seen in a mentally ill person. The changes in their perception, the changes in their thoughts or reasoning can lead to changes in the way the person talks or the person reacts and behave, which I'll explain it. Let me explain it once more. When a person or an individual is suffering from mental disorder, it is basically going to lead to changes or alteration in their perception, alteration in their thought process, and alteration in their reasoning. When there is a change in their mind or when there is a change in their mental processing, that leads to changes in that individual's way of communicating and changes in the way the person is going to behave, which is going to be very much different from their previous personality. And this changes is not only going to affect that particular individual, but it is also going to affect the people around them. It will affect them emotionally as well as physically, and that can lead to suffering or distress to the other person. For example, in case of schizophrenia, the main symptom is hallucination. There are different types of hallucinations and delusions the person go through. In case if it gets severe, that can lead to self-harm as well as that can lead to suicidal ideation, and the person can not only injure themselves, they can also physically injure other people who are around them. Okay, moving on to the next slide, which is the last topic for today, causes of mental disorders. I have put up 4 different causes, which is biological factors, life experiences, psychological and emotional factors, social and cultural factors. So these 4 different factors can directly or indirectly lead to the formation of mental disorder. There is not a single cause, there is not a single particular cause, but there are different causes which leads to the occurrence of mental disorders. We'll start with the biological factors. So it mainly includes genetics and chemistry, which is brain chemistry. So an individual is when we see the genetics, an individual is at risk of getting a mental disorder or is at risk of getting affected by a mental disorder in case if there is a family history of mental disorder. In case if somebody in the family is already affected by some kind of mental illness, the individual is also at higher risk of getting that particular illness. This can occur due to alteration in the DNA. And when we talk about the brain chemistry, you all might be very much familiar with neurotransmitters. So alteration in the neurotransmitters, especially dopamine and serotonin, that can lead to the formation of mental disorders. Along with that, if there is any changes or alteration in the size of different parts of the brain, for example, the hippocampus or the amygdala, that can also lead to the formation of or the occurrence of mental disorders. I'll explain it once more. Biological factor mainly involves genetic and brain chemistry or brain structure. For example, if an individual has a family member who is already suffering with mental disorder, they are at higher risk of getting that particular disease, which can be due to the alteration in the DNA structure and brain chemistry. So if there is any alteration in the neurotransmitters, which is the dopamine and the serotonin, that can also lead to the formation of mental disorders. Next one is life experience and trauma. In case if a person has childhood trauma, which can be due to stress, neglect or abuse, that can also lead to mental disorders. Not only trauma, but at the same time, if they have been dealing with intense or prolonged stress, that can also lead to the occurrence or formation of mental disorders. Next one is psychological and emotional factors. Psychological and emotional factors. When a person is going through emotional distress, or if they're going through emotional stress, or if they are finding it difficult to cope up with different situations in life, that can lead to the formation of mental disorder. One of the main factor which comes under psychological is low self-esteem. So low self-esteem mainly influence the occurrence of mental disorders psychologically. The last one is social and cultural factors. When a person is not accepted by the society, or if there is any kind of stigma, or if there is any kind of violence which is present in the community, that can lead to mental disorder in that individual. So these are the 4 different factors which are leading to the formation of mental disorders, either directly or indirectly. So this is about today's topic. Let me summarize the topic once again. So today I have started with the subject mental health nursing, where I have started with the basics and I have covered 4 different topics, starting with definition, and then difference between the brain and the mind, characteristics of a mentally healthy and a mentally ill person, then causes of mental disorders. I hope the concept of all this is clear to you all. And if you have any queries, or if you have any questions, you can put your questions or queries in the comment box, and I'll be explaining it to you in detail in the next class. And I hope all the topics which I have taken for today is clear, and you have all understood the topic. So that's all for today's class. So if you want to get a detailed explanation, or if you want to know more about the topic, you can download the Easy Nurse app from the Play Store. And there is also a link regarding the MCQs which will be available on Telegram. And there are contact information given below in the slide. So you can contact us either through Instagram or through Telegram. So thank you.